Hello, I'm glad that you clicked on this video. Today we're going to be talking about a book called the Psychogenic Non-Epileptic Seizures Pocketbook. So just a few facts about this book, and really if you are a clinician, this is something you're going to want to pay attention to. This book is meant for you. So the book has two authors, Dr. Julia Doss and myself, Dr. Lorna Myers. Both of us are clinical psychologists with expertise in PNES. Dr. Doss specializes in pediatric PNES, and I specialize in adult PNES. The book is available on Amazon in paperback and Kindle version. It's 149 pages long, and it's really essential for clinicians who are looking for a quick access resource of necessary information on this disorder. The audience it's meant for is an audience of clinicians, primarily psychologists, psychotherapists, medical doctors, general nurses, school nurses, and counselors, as well as educational staff. Now, in the next few slides, we're going to go through chapter by chapter. There's a total of 8 chapters, just so that you can see a bit about what each chapter touches on, and to see if this would be a valuable resource for you. Chapter 1, a brief introduction to psychogenic non-epileptic seizures, PNES. It includes a definition of the disorder, as well as going through a discussion as to what name is the appropriate name to use when calling this what it's called. You'll hear me call the disorder PNES, but there's a number of other names that have become popular and some older ones that are less popular and have even been abandoned. Important to know the history of the names, as well as the history of the disorder, which is not a new entity. In fact, PNES has existed for many hundreds, if not thousands of years. The chapter also goes through risk factors in adults and children, coexisting psychiatric conditions that's important to know about, and it closes by discussing persistent myths and biases associated with PNES, as well as challenging each one of these. Second chapter is diagnosing PNES. And it starts out by asking, really, why is it important for a psychotherapist to know about diagnostic issues? And it answers that as a clinician who's going to be treating someone with PNES, how they were diagnosed and how the diagnosis was presented is very important. And so the therapist should be familiar on some level with the process of diagnosing a patient with this. So the chapter goes through how PNES is diagnosed, any additional testing that might have been used, how the diagnosis is delivered, and then answer some final questions about diagnosis and treatment referral. Chapter 3, treating adults diagnosed with PNES. And the chapter is not meant to be a comprehensive overview of all these different therapies, but it does touch on each one of the therapies that has so far been empirically tested or has been reported in peer-reviewed publications. Each one of these therapies is also on some level tailored to work with PNES, and the chapter describes some of that and how those modifications will show up in these treatments. So the basic treatments that have been reported for PNES include cognitive behavioral therapy, CBT, mindfulness-based therapy, MBT, certain psychodynamic therapies, group treatments, psychoeducational and therapeutic, and prolonged exposure treatment for PTSD and PNES. Something that's really interesting about the chapter is that it also goes on to discuss the common features that all of these therapies for PNES share, including not just the targets, but also some of the tools that will be used regardless of what treatment modality you're using. And it closes by talking about some of the other challenges that might be encountered in treatment. Chapter 4 focuses on treating children and teens who have PNES. It starts out by going over the barriers that a therapist might encounter to treatment, the barriers that the family might also encounter to treatment, pediatric specific considerations, certain methods that need to be put in place when treating youth with PNES, and it goes over therapeutic techniques for this population. Chapter 5 looks at managing PNES in a professional setting. This is very important for a clinician who is perhaps concerned about seeing a patient in person, a patient who has seizures, how to prepare, but also seeing a patient virtually. So the chapter starts out by going over what sort of information to collect on seizures, either in that initial phone call or in the initial session. It also goes over seizure safety during in-person and during virtual sessions. It offers a sample therapist-patient agreement, and it discusses in greater detail virtual therapy sessions for PNES and certain things to consider when you are engaging in that type of treatment, which has actually become much more common since the pandemic. Chapter 6 goes over living with PNES, especially focusing on employment issues. These are some questions and some issues that may come up for a therapist when they begin working with a patient who has PNES. Should the patient continue working or not? What are reasonable accommodations? What are some typical workplace challenges and even discrimination that the patient might encounter? And what to do about that. The chapter also goes over seizure response plans for work. Each person is different, each work site is different, but these are some sample work plans that the therapist and the patient can then further tailor. And then the question, when should the Social Security or disability route be pursued? And the chapter does go over some of these issues, some issues to consider, how to weigh one way or the other. Chapter 7 looks at living with PNES as a student, including practical first steps for when the diagnosis is made and the child is in school, how to manage peer and social relationships, how to manage extracurriculars, and college-related concerns that may also come up at this time. Chapter 8 goes over other practical issues and recommendations for living with PNES. Anything from what to do about driving a motor vehicle, what about using public transportation, what are some of the safety concerns to keep in mind, what about traveling abroad, personal issues, dating, marriage, having children, recommendations for parents of a child who has PNES. There's a whole smorgasbord of information on practical issues that might come up. And then the book closes with an appendix that has a series of online resources, PNES websites, PNES blogs, social media. It also discusses and provides links to the PNES scholarship that is hosted by Epilepsy Alliance America. And for rare and intractable cases, the appendix also includes certain safety devices that might be considered by the therapist and the patient to ensure safety, perhaps temporarily or perhaps longer term. So that's it for this presentation. I'd like for you to stay in touch. You can contact me at that email, lmyers@epilepsygroup.com. And I hope you enjoyed this and that you will consider getting your hands on PNES Pocketbook.